So the next talk, the plenary talk, is by Padma Shri Honorary Brigadier Dr. Arvind Lal, sir, Executive Chairman, Dr. Lal Path Labs. Sir, welcoming you, sir.
So it's my pleasure to invite Dr. Arvind Lal, Honorary Brigadier and Padma Shri, to present his plenary talk. I think Dr. Lal is a household name nowadays in India, and he really needs no introduction before this audience of medical laboratory sciences. So without further ado and without wasting our time, we invite Dr. Lal. Dr. Lal, please.
Thank you so much, Dr. Datta. Thank you very much. So, ladies and gentlemen, because of the eternal shortage of time, I shall try to be brief. And I have got I'm an elderly or older person now, so I can't remember so many facts and figures. So I have noted down a few things. So first of all, it's indeed a great honor to be a part of the 5th National Conference of Indian Confederation of Medical Laboratory Sciences, ICMLS 2004. I would like to thank the organizers of the conference, especially Dr. Kaptan Singh Serawat, President ICMLS, for extending this warm invitation to me. Thank you once again. Let us go to a remote village in India. A mother in the village walks a few kilometers carrying a child who has high fever to reach the nearest doctor. Thankfully, she meets a qualified MBBS doctor who examines the child but cannot infer with certainty whether the child is suffering from typhoid, malaria, dengue, chikungunya, or is it the beginning of hepatitis A, B, or C, or something else. He must order a few tests to correctly diagnose and treat the child. And rightly so, as I said earlier, diagnostics are responsible for more than 70% of clinical decisions or medical decisions in modern evidence-based medicine, guiding doctors from uncertainty to clarity and turning symptoms into diagnosis. If the diagnostics are not available in the village, then the quack or the rural medical practitioner, you've all heard this term, RMP, he gives what we call a gunshot 5C treatment. And what is this 5C treatment? That is, no test has been carried out. This means giving a pudia in which is crushed crocin, chloroquine, chloromycetin, crocin to bring down the fever, chloroquine to fight malaria, chloromycetin to fight typhoid, cortisol, which I call in my own North Indian language as Amrit Dhara, it can bring down anything, and of course, cold compresses. So this 5C treatment is given in the absence of any lab test. These are the medicines which even in towns are even being given today by doctors in this very town. The critical role of diagnostics was thrust into the global spotlight during the COVID-19 pandemic. And this shaped the strategy that all nations relied on to control and to stop the spread of the disease. That was test, track, and treat became a universal mantra, essential for identifying cases, monitoring transmission, and guiding timely medical intervention across the world. RT-PCR testing, once a term known only to healthcare professionals like us, became a household word, at least in India. For the ordinary layman, RT-PCR kara lo bhi. This experience during the COVID pandemic understood that diagnostics are not just a foundational aspect of healthcare, but are indispensable in managing global health crisis. People got to know that you could not treat COVID without diagnosing it. Behind the scene, medical lab technologists are the ones responsible for carrying out these tests with precision, accuracy, and releasing the reports on time, making them the unsung heroes of evidence-based medicine. I often used to tell my own staff that you have to give the report on time. You see, we are the only ones who cannot dilly-dally. A clinician can say कि आप कल आइएगा, मैं test कराऊंगा, कुछ करूंगा. But you and I have to give the report in the time, and especially in private practice, he has given you the money in the morning, he has a receipt, so you have to give the report in the evening. He has already fixed up the appointment with the doctor. So if this is not done in a loose kind of a manner, either the disease will not be there or the patient will not be there. So you please remember that timing is very important of the report. Though these professions are rarely seen by patients, they play a pivotal role in the healthcare continuum. In fact, every diagnosis is a collaboration between the physician or the physician's knowledge and the lab technologist's skill. With the advancements in healthcare that leverage cutting-edge technologies to deliver accurate and personalized care, medical lab technologists will be at the forefront. Their role is expanding beyond traditional testing to encompass a blend of technological expertise, data interpretation, and collaborative clinical support. Lab medicine and diagnostics have always been at the forefront in adoption of technology. Who brought the analyzers or who brought computers into India first in healthcare? We did. Who automated the labs, auto-analyzers, etc.? We did. Therefore, it is imperative that today's laboratory scientists prepare for this evolving role and add skills to use the technologies for ensuring the highest quality of testing. Today, most analytical processes are automated with range of instruments from small automated analyzers to high throughput connected modular instruments, which are almost hands-free. But what still needs significant attention is the pre-analytical phase where 70% of lab errors occur. This is very important. This phase includes sample collection, labeling, transportation, and preparation. Addressing these errors requires not just technology, but a skilled human touch. Therefore, it is no surprise that Dr. Lal Path Labs, under its CSR flagship skill development program, through which over 7,500 lab phlebotomists have been created. We train close to 3,000 phlebotomists every year with the aim to create a cadre of highly skilled healthcare workers who can help reduce the burden of pre-analytical phase errors. And you understand that from a lab phlebotomist, he can go to the next step. He can become a junior lab technician or MLT and then go on so forth. Once the samples are prepared, they enter the lab information management system, or what we call LIMS, which has become akin to the cardiovascular system of the lab. The LIMS connects all instruments, eliminating transcription errors, optimizing workflows, and maintaining strict quality metrics. Information technology, optic fiber-based Wi-Fi internet connectivity, and increased high-quality lab management system, or LIMS, will transform the role of a medical lab technologist, demanding not just clinical knowledge, but also a fluency in technology. You all will always be at the cutting edge of technology, I can assure you. The technologists have become as much data managers as they are scientists, ensuring seamless integration between machines and accurate diagnostic outcomes. But automation cannot entirely eliminate the need for specialized skills. Upskilling throughout an MLT's career is important, and honing specialized skills in areas that still need a lot of manual expertise should be paid attention to. Everything cannot be automated. Some of these fields include histopathology, special stains, molecular diagnostics, HPLC, electron microscopy, LCMS techniques, proteomics, etc. These are fields where the human touch, that is, in MLT's judgment, precision, and expertise is irreplaceable. Dr. Lal Path Labs, we run a program called Hunar for our internal lab scientists to provide specialized training and certifications on the job. I'm also happy to inform you that we are the biggest histopathology testing lab in the world. by processing up to, we process up to 1,400 biopsies in a day. As healthcare shifts towards personalized approaches, lab technologists play a crucial role in the performing genetic and molecular tests that drive individualized treatment plans. By analyzing genetic markers, cellular responses, and personalized health data, they help clinicians tailor therapies to each patient's unique profile, enhancing the effectiveness of treatments and thus providing an important facet of what we call personalized medicine. Diagnostics now involves managing and interpreting vast amounts of health data, requiring lab technologists to develop expertise in data analytics. So be careful. Now, this is what is going to come to you now. Working with big data will allow them to identify trends, provide insights for early diagnosis, and support predictive healthcare, helping to prevent illnesses before systems even arise. Another crucial focus area for technologists is quality. So remember, there are three things which ail Indian healthcare. One is accessibility, one is affordability, and the third one is quality. Don't want to go too much into it, but they are self-explanatory. The use of data and technology to continuously improve sample flow and quality of results is now an imperative. For example, implementing moving average for continuous quality measurement. This enables detection of systemic errors in instruments 24/7, and not just at the time of running quality controls. You all know that now. The modern medical lab technologist is no longer confined to just processing samples. They are now innovators, collaborators, and lifelong learners. They ensure that every diagnostic report is accurate, timely, and impactful for the patient's healthcare journey. Lab medicine today is far more than just mastering processing techniques. It is constantly pushing the envelope for learning skills that can ensure high-quality reports and value for each sample that is processed for the patients. In the future, I envision that lab technologists will need to collaborate even more closely with other professionals like clinicians, bioinformaticians, AI specialists, genetic counselors, etc., to interpret complex diagnostic data to provide holistic care. Their insights will be vital for guiding decisions, managing treatment courses, and facilitating communication within the patient care team. Medical lab technologists must take pride in knowing their work underpins evidence-based medicine, guiding clinical decisions and save lives. From addressing pre-analytical challenges, as we just discussed, to harnessing cutting-edge technologies. They are not just keeping pace with healthcare advancements. In fact, they are actively shaping the future. I would like to appeal to all of you to work towards attracting more candidates to pursue a career in medical lab sciences. Given the dynamic nature and the advancements in the field, it is becoming lucrative for the tech-savvy youth. We need more collaborative efforts between educational institutions, collaborative efforts between healthcare industry and the government to offer scholarships, internships, mentorship program that can further encourage young talent to choose MLT as a rewarding career path. I also firmly believe that medical lab technology can emerge as a large employer in the country. You know the problem in India. Mr. Modi has got lesser votes this time because of failure to create jobs. Please remember this. And this is where you come in. I also firmly believe that medical lab technology can emerge as a large employer in the country and contribute to the economic growth of numerous families and even the nation. This is a low-hanging fruit to provide employment to the youth of the country. India needs to create nearly 1 lakh jobs every month. That is more than 10 lakh jobs per year. And for that, you will not find many professions like medical lab technology, wherein within 2 years of passing class 12 exam, a person can become a respectable breadwinner for the family. With India's population reaching nearly 145 crores, and the increase in the burden of non-communicable diseases or NCDs like diabetes, hypertension, cardiac diseases, and strokes, liver, kidney, and lung diseases, etc., The role of lab medicine cannot be overemphasized. I said earlier that you will always be at the cutting edge, and you are at the cutting edge. Diagnosing these before the onset of a full-fledged disease would mean testing crores of people in their so-called good health, or what is known as preventive and wellness testing. By testing early at the primary health level, we can significantly lessen the burden during the advent of the full-blown disease, which then requires hospitalization in secondary and tertiary hospital like AIIMS. We can also increase the life of an individual by testing him in so-called wellness rather than in illness. This means that there will be literally, now this is the punchline, a tenfold increase in the creation of phlebotomists and lab technologists in the changed scenario of healthcare in India. I envision that India sooner than later will adopt a policy wherein highly trained lab technologists will be running hundreds and thousands of clinical laboratories in India of the future, which are linked together with sophisticated digital networks ensuring high-quality diagnostics. According to an Indian Express report, there are 3 lakh laboratories in India, and from my calculation, it can grow by tenfold. That is 30 lakh labs in India is what we require to handle a population like ours. But those labs have to be testing labs and not testing shops. You understand what I'm saying? Whether the healthcare administrators in India realize it or not, laboratory testing will be the #1 healthcare task to be fulfilled if India wants to control NCDs and prevent the 2% GDP loss caused by these NCDs. These NCDs bring down your financial ability of the country by 2% of the GDP. If we are to become the 3rd largest economy by 2027, lab medicine has to be given the #1 position in healthcare. As you all know, most of the NCDs can be reversed or arrested if detected in their initial stages. This means that lab medicine is going to see literally a volcanic explosion in the near future in the healthcare of the country. Thank you very much.
Thank you, sir. Thank you, Dr. Lal, for your enlightening lecture, defining the role and responsibilities of the laboratory medical professionals, and as well as outlining a vision for the whole community in the near and even the distant future. So thank you, congratulate you again for this enlightening thing. Any questions, any thoughts? So if there are none, you have? Huh? Last bench, please come up. Please come ahead.
Good afternoon, sir. Sir, recently in our AIIMS,
Could you please introduce yourself also?
Sir, we recently set up a clinical toxicology lab in our department. So regarding this, I have a question that, is there any way that we can able to get a training in Dr. Lal for ICPMS and LCMS?
Yes, we do have internship programs, and you write to us, and I think we can accommodate you for some time for training purposes. Not a problem.
So I think Dr. Lal has several training facilities and programs which helps in building up the the competence of the cadre, and I think those can be utilized very usefully. So if there are no more questions, I congratulate again Dr. Lal for his excellent speech, and thank you, sir. Thank you.
Thank you very much. Thank you.